So in dental school, whenever we ran into an issue, we always referred back to the prosthodontist. He was the quarterback in terms of running the dental team, in terms of treatment planning, and looking at the big picture instead of one quadrant at a time or one tooth at a time. So I wanted that confidence, and I wanted to provide to my patients what is going to be the best for them. My name is Dr. Mohad Faraj. I am a surgical trained prosthodontist. With the tools that my specialty gives me, I'm able to afford to provide to my patients a big range of treatments within the same office. So I can do surgery, and I can also do veneers, crowns. So being able to comprehensively treatment plan and execute that plan is what motivated me to go into this specialty. So there are many different options in terms of dental implants. It is the best option that we currently have to replace missing teeth. It can act just like your natural teeth. You don't have to take them in and out, and they're cleansable, they're functional, and they can be very, very aesthetic. We can use them to replace a single missing tooth, whether it's an anterior or posterior. We can use them for 3-unit bridges or even for full arch restorations, whether it could be a snap-on denture or an overdenture that can help retain a full denture, or fully fixed full arch cases where we place 4 to 6 implants and patient receives a high aesthetic, very functional, permanent set of full teeth that they're able to enjoy the day of surgery. So being at a center where we have the specialist and the GP working side by side, it makes that very seamless. So the doctor can just stop into my office, or I can go see patients right next door, and we can have a fluid conversation with the patient in the chair to be able to diagnose and treatment plan on the spot. It is more of a team effort because at the end of the day, it's not about me or that provider, it's about the patient. And whatever that patient needs is what we're going to be doing.